Look now at coronavirus cases on both sides of the state line. Missouri reports more than 1,600 new cases since Wednesday. That's a new record. We'll get an update from Kansas tomorrow. Missouri's percentage of tests coming back positive jumped from 7.9 to 8.9. Kansas health officials say almost 40% of the cases in Kansas are people ages 18 to 34. Now we look at this rolling 7-day average of positive tests to see how the virus is currently spreading. 3 weeks have passed now since mask mandates went into effect in the Kansas City area. And today, investigative reporter Matt Fleener asks the region's top health officials if we're starting to see any effect in stopping the spread of COVID-19.
I have 4 votes in favor.
3 weeks ago, 4 votes in favor of a mask mandate in Johnson County.
It is required by
now 3 weeks later.
Do you have any data to show that the mask mandate in Johnson County has worked?
Yes, we have seen a flattening of the increase.
Dr. Sanmi Ariola pointing to a 7-day moving average of new cases flattening in Johnson County. But every public health official we spoke with today said we need just a bit more time.
Do you believe the mask mandate has worked to drive down the spread of COVID here in Kansas City, Missouri?
It's going to take at least another 2 to 3 weeks to start to see the full impact.
Dr. Rex Archer says he's encouraged because compliance has gone up in Kansas City, Missouri. In Wyandotte County.
When would you expect to see the results?
I think we really would need to wait at least another few weeks.
All counties urging patients and not to give up wearing masks.
Long term, we have to bring the transmission down.
Matt Fleener, KABC 9 News.
And we will keep checking over the next few weeks to see if the masks orders are making a difference. There's a warning today from Johnson County, Kansas. The health department is seeing young adults getting COVID-19 from house parties. Right now, the largest age group with COVID-19 is between 20 and 29 with more than 1,000 cases. The 10 to 19-year-old age group has 527 cases. The health director is asking people to avoid bars, nightclubs, and house and graduation parties to help contain the spread. One day after the Kansas State School Board rejected the governor's plan to delay school until after Labor Day, the Kansas Health Secretary says Kansas need to pull together. Dr. Lee Norman is tweeting out, "We are headed into unprecedented territory as the virus gains speed through our state. Now is the time to pull together and fight the virus, not each other." Districts will now decide when schools will start in the fall. Shawnee Mission and Blue Valley in Johnson County, Kansas will start after Labor Day. The Olathe School District will discuss its back-to-school plans tonight. The school board meeting starts at 5 o'clock and will be live streamed on the district's YouTube page. The Lawrence School District is also planning to start after Labor Day. Superintendent Anthony Lewis says his team has been working on the school calendar since last month. He's planning to release a plan for the new school year at Monday's school board meeting. Tomorrow, the school board for the Kansas City, Missouri Public School District will vote on back-to-school plans. Under the proposal, all classes will start online September 8th. Then the district will start moving into different phases of in-person learning if it's considered safe. For example, Phase 2 will include in-person classes for preschool through 3rd grade. Phase 3 will be a hybrid of in-person learning and virtual learning for 4th through 8th graders. The district says the goal is to eventually be back 100% in-person learning. The board votes tomorrow at noon. Nationwide, school systems are grappling with ways to safely reopen. For many districts, school nurses are a key part of that equation. KMBC 9's Bree Jackson is in Washington.
According to the National Association of School Nurses, more than half of public schools nationwide did not have a full-time nurse before the pandemic. Advocates say in order for schools to reopen, they need more nurses inside.
As schools look for safe ways to reopen, officials predict school nurses will be front and center addressing an influx of health concerns.
For fear that tickle in their throat is COVID-19.
Advocates say school systems need more resources, including additional nurses. But even before the pandemic, there was a nationwide shortage. Roughly 1 in 4 schools did not have a nurse at all. With local economies shutting down and states losing revenue because of COVID, advocates worry staffing problems will worsen.
Already translating into reductions in force by school systems, including the reduction in the school nurse force.
On Capitol Hill, negotiations over the next stimulus package are underway.
What we have seen so far falls very short of the challenge that we face.
I wouldn't give you a deadline. I'd rather have a bill done correctly than set by a certain date.
Both sides want some form of funding for schools, but remain divided over several issues, raising concerns a deal won't pass before some students return in August. School nurses fear without federal support, their jobs and the services they provide could be at risk.
School nurses say about 25% of their cases are for chronic illnesses, such as students with asthma or diabetes. They say COVID cases will only increase the workload and concerns about students' health.